Hey, it's Dr. Allin here at Evolve Chiropractic in Woodstock. I'm gonna help you figure out whether you should use cold or heat on those sore, achy areas in your body. So the best rule of thumb is if you have a traumatic injury, so a sprain, strain, anything like that that's brand new, so within maybe 2 days, ice is typically gonna be your best friend. Ice will reduce the blood flow going into an area, which then reduces the swelling and the inflammatory fluids kind of collecting into a certain area. So it's best to put ice directly on the skin. If you have a cold gel ice pack, they're nice because they can conform to your body. I like crushed ice in a plastic baggie. That works really well also. But basically you just want to put it right on your skin. Now the time that you hold the ice here is important. You have to go through 4 different stages of cold therapy. So cold, burning, aching, and then numbness. And usually that takes anywhere between 10 to 20 minutes to get to that numb state. And as soon as the tissue gets numb, you take the ice pack off and the treatment's over. You can repeat this basically every hour on the hour as needed. So pretty safe, and you really don't have to worry about, you don't have to worry about frostbite or anything like that, as long as it's not like one of those black ice things that they have in some of the food storage containers. Make sure that it's used for humans, and that it's not going to be too cold, right? You don't want to use dry ice or anything like that because that can burn the skin. But typical just ice that you get out of your refrigerator or freezer, totally fine. Gel packs, totally fine to put directly on the skin. It gets a much better therapeutic result that way. So as far as heat is concerned, if you use heat, it's best to use some form of a cover. Also making sure that there is some moisture on that cover. The packs that we use in the office are made out of a clay substance that kind of holds heat a little bit better than most devices. And we use these nice soft covers to protect and dissipate some of that moisture that gets held into the pack. So again, when you're putting these on, they go right on, but you want to make sure you have some form of covering. Depending on what you're using, you can just use a damp towel with a hot pack on top, and basically you're just going to hold these on about the same amount of time that you would for ice, about anywhere between 10 to 20 minutes. You don't have to worry about going through stages. It's just going to get very warm, and if you can tolerate it, you hold it on there. If it's too warm, you might have to let it cool off, but you want to aim for that 10 to 20 minute time frame for treatment. Heat can be done very similar to like ice is, every hour on the hour. The other option would then be to do contrast therapy. So now heat is good for like muscle spasms, tight tension muscles, chronic patterns, like you've been sitting at a computer all day and your muscles are really sore and tight. That's where you would use heat alone. Now, if you have a combination between inflammation and muscle spasms, so say you put ice on your body and it makes things feel real tight and it feels worse after you put the ice on. In that case, you want to do a contrast therapy. So basically you put ice on for 10 minutes, then you put the heat on for 10 minutes, and you repeat that twice. So it's about a 40-minute treatment where basically we're taking the tissue, we're bringing in blood flow, getting everything to swell in, and then we're adding the ice to decrease blood flow and squeeze everything out. So it acts kind of like a pump to the area and assists in flushing out inflammatory byproducts, helps with the muscle spasms while also addressing the inflammation. So I hope that's helpful. I know there's always a lot of controversy as to whether to use ice, heat, or both. I hope this clears things up a little bit. If you have any questions, feel free to reach me here at the office, and I'll see you soon.